Hi, everyone. Welcome back. We're back here with Dr. Geetha Kamath, one of our co-authors in the book, How Healers Heal. Hi, Dr. Geetha. Please introduce yourself.
Good morning, Dr. Shilpi. It's my joy and pleasure to be part of this wonderful group and sharing my experience today with you. I am a physician practicing in academic medicine. I am board certified in internal medicine, obesity medicine, and lifestyle medicine here in the US and have been practicing for over 2 decades. Before that, I was a practicing OB/GYN in India and born and brought up in India, did med school in India with that background and lifestyle being a part of my upbringing, both vegetarian nutrition, the religious circumstances, the cultural background of yoga practices and meditation, which I moved away from, I guess, as we went into the Western evidence-based medicine and started practicing labs, diagnosis, prescriptions. And as time went by, got into the journey of coming back to lifestyle medicine, and life's back in a full circle, and happy to share with you more about it.
Thank you. I mean, your chapter is amazing about how your journey came about and how you went back to your roots. But tell us, how did you get formally introduced to the field of lifestyle medicine?
Well, I was practicing with the Veterans Administration for over 10 years. And during this time is when I was noticing that the chronic pain, the opioid crisis, the challenges of weight management, obesity, diabetes epidemic was all growing. We were trying to deal with all this with more prescriptions, more labs, and more procedures. And I could see the frustrations both at the side of the physicians and the patients, because it felt like they were always coming back saying, it's a little better, a little worse, not getting better, what's going on? And I too, as a physician, was seeing that what we were trying to do was really not helping in the big picture, and something was missing. And that's what made me look around and say, what more can I do for my patients? About this time, I also realized, I was having a growing family. During residency, self-care had taken a background and did not care for myself. I had also put on some weight. My family history of diabetes, all that was trying to come along. And I think all these things added to me taking a deeper dive and looking into how can we make things better for ourselves and our patients. And along this time came the introduction of obesity medicine and lifestyle medicine, which were showing a lot of evidence-based practices. And I was fortunate enough to look into it further and get certified and share the generous benefits with my patients and practice it on myself and my family.
That is so wonderful. So instead of trying to burn out, which a lot of us do, you looked for other avenues. You found obesity medicine and found lifestyle medicine, took the initiative upon yourself to learn more, get certified, and now you use it in everyday practice. That's so amazing. Thank you, Dr. Geetha. So tell us a little bit about how you use it in everyday practice. I don't want you to share any patient details, but if you have general examples, please let us know. Do you still work at the VA? Or you said you're in academic medicine now.
Yes, I did go into full-time academic practice because that's where I was able to practice full-time obesity medicine and lifestyle medicine and teach the next generation of students and fellows. So I felt like I could share my knowledge and spread the wealth and make more generations of physicians be able to practice this. And it would touch upon more lives in that way. I felt that was my calling. And so I moved on, and I'm happy to say that I have been able to continue my work in a very successful way in University of Missouri, Kansas City. And that's what I've been doing for the last 3 years, promoting nutrition, lifestyle medicine, dealing with the practice of challenges of obesity, and helping patients regain control over their health, well-being, especially during the process. And it's very rewarding to see people get off their medications, come back and tell me, I can play with my grandkids now. I can bend down and tie my own shoelace and don't have to wait for somebody to come and do that for me. And things like that, day-to-day things, which mean a lot. The patient who came, for infertility and weight loss, and then a year later comes with her baby, is so rewarding to see. And these are the beautiful stories which take me back to work day after day. So it's a beautiful combination when we do a practice of habit changes, which take a lot of time, supporting them through the journey. Sometimes they do need help with medications, but the habits become the foundation which eventually sustain their health maintenance along with some of the medications, or reducing the pill burden, and maybe even has averted many procedures they might have needed, like stents or blockages that needed to be fixed. Like one of our favorite lifestyle medicine doctors says, would you rather eat a carrot or end up with a stent? So that's what I tell my patients too.
That's so wonderful. I mean, you touched on something that you're creating little ripple effects that are affecting giant communities, one patient, one family, one community, one neighborhood, but you're also touching the next generation. That is so, so amazing. So how do your residents, are they, I hope they are receptive to this amazing evidence-based practice of lifestyle and obesity medicine. How do your residents respond to your training and your implementation of these techniques with patients?
They are absolutely fascinated because they come in during their first clinic visit thinking it's all going to be about either prescriptions for weight loss or suggesting bariatric surgery, and patients are going to leave and come back with results. And when they see the extensive nutrition, stress management, sleep hygiene, education we give them, the resources we provide, and the constant support at follow-up visits we give, and the patients are responding and saying, I have so much more energy and I feel so much better, they are fascinated. Then they see the patients telling, I was on 4 blood pressure pills and now I'm on 1 or none, or I've lowered my dose of insulin. They are very impressed, and they become believers when they see that. And they also see the challenges that the patients go through, because it's not a smooth journey. People will have holidays or have side effects to medicine or some kind of stressors. So we tell them it's about progress. It's not about perfection. That's what life is. Roll with resistance. Be compassionate and kind to yourself. And these are the life skills we teach patients. And it's frustrating sometimes for us too if we don't see the results like patients do. So learning how to empathize with the patients and being patient is a journey for both the patient and for us. And teaching those residents and fellows is a wonderful experience. Now we have even the medical students who have founded the Lifestyle Medicine Interest Group, LMIG, and we have done some nutritional talks, had panels and lectures. So we are starting at a very young level, as young as the third-year medical students interested and have initiated this group. So it's a beautiful calling. We also started the food pantry right next to our clinic, so that we are not just talking the talk, but walking the walk. So the patients who tell us, you don't know how hard it is to get good food or healthy food, we give them immediate support. They can walk next door to the food pantry and get some fresh and frozen produce and start making healthy choices right as they leave the door. And so we have started some initiatives that have been able to help them successfully practice and make those changes that we talk about in the clinic.
Wow. I mean, I'm blown away. You have a food pantry next door and you're able to accomplish all of this in the short 3 years that you've been at the university. How did the food pantry get started? Tell me a little bit more.
Well, it's a team effort. Certainly, I was not the only one. We have a great support system with our institution and our leaders, and our endocrine nutrition system and our other leaders were interested in this. And we have a big food pantry in the city called Harvesters. So I think the institution teamed up with the Harvesters and managed to have a small room right next to our clinic. About a year ago, they piloted the food pantry with 3 of the clinics. one of them being our weight management clinic and the other one being the OB clinic and a pediatric clinic. And now they're hoping to extend it to all the patients. As patients come in, we just provide them with the questionnaire. It's a self-answer questionnaire, so they are not embarrassed to talk to the nurse or express it, because one of my students actually did a QI project this year and she presented it. It was a very successful poster, which showed that more people responded if they did a self-answering questionnaire rather than when nurses or somebody in the medical staff asked them questions about food insecurities. And we saw a significant rise when it was something that the patients filled in themselves, and they could take the handouts and walk to the pantry next door, and they can go back on a weekly basis and get as many supplies as they qualify for, and they have a criteria and things like that. But definitely they have more access to healthier foods than before, and now they don't have to run to another setting or another location. As you know, most of these people have transportation issues and other challenges. So that's where we are able to meet their needs when they come to the clinic setting or when they are around the hospital. So it's beautiful to see that we are able to take care of some of their other needs besides just medical needs.
That's so wonderful. I'm so inspired. I hope a lot of other clinics and doctors can be inspired to kind of help with their local food bank and maybe start similar initiative. That's so wonderful. Okay, I'm going to switch gears a little bit to the book. Why should doctors read this book, How Healers Heal, and why should patients read this book?
Well, it is about not keeping this a secret. The secret sauce should be shared with everybody so everybody can have the elixir and enjoy the flavors of lifestyle medicine and enjoy the benefits of lifestyle medicine. It's, as you know, all the good things in life are free: healthy foods, good sleep, stress management. None of these really cost a fortune, unlike expensive pills, prescriptions, and procedures. Besides, these come with minimal side effects. They definitely need the support of society, community, friends, and physicians. I think knowing that these are not just stories from anecdotal findings, but evidence-based medicine. There's a lot of research background, and it has proved that it is truly beneficial, especially in times when we are seeing that the chronic disease burden is increasing, the expenses, the economic burden, the Medicare revenues, and the future is bleak if we continue this way. A lifestyle seems to be the only hope in mitigating all these challenges significantly. And I think this is very much complementary to the current Western medicine we practice. The Western medicine is very helpful in acute settings. Definitely, we have seen it help during COVID in immediate treatment, in the ICU settings. When somebody has a fracture, you want it to be taken care of immediately. But when it comes to long-standing chronic diseases, which are not communicable or transmitted from one patient to other, like diabetes, it's only self-inflicted or happens to oneself. You don't share it with your family member, like respiratory infection or infections of other kinds. So that's where I think learning habit-changing processes, behavioral changes helps, and hearing from stories of people who are practicing it, patients who have been successful, and how we are actually able to practice it in current world might be motivating, inspiring, and help find the resources for people who are curious to learn more about it. I hope we will be able to sow the seed and help beautiful gardens and forests of lifestyle medicine grow and provide shade and shelter to a lot of people in the community who need it.
I love your answers. You are so inspiring. What is your number one tip for self-care for someone, for yourself, or a lifestyle medicine change if someone wants to get started today that you can advise?
I would say start with one or two simple, easy things that is realistic in your world. Be patient with yourself and look for progress. Don't look for perfection. That would be very frustrating because there are so many things we can aspire to do, So making one small change at a time, whether it be nutrition or a little bit of more sleep or a little bit of cutting out on your game time and video time or stress management, pick one or two things and then start building up on the success and the progress. And don't beat up yourself if you're not able to even achieve that perfectly. Again, it's about progress, not perfection. That's my favorite mantra.
I love it. Thank you so much. Is there anything else you want to mention before we wrap up, and how patients can connect with you, or doctors or other professionals can connect with you?
Absolutely. I would say explore this with an open mind, what we call a growth mindset. You don't have to be a believer. You just have to explore it for yourself, and do not expect instant results. Anything you do should be given time, at least a 3 to 6 month period, just like you would sow the seeds for a plant and not expect the lawn or a tree to grow overnight. I would say practice whatever you're doing consistently for 3 to 6 months before you say it's making a difference. And I can be certain you will see some improvement in whatever practice you put in, and you will notice that it's making a difference. We are all here to support you. There's a lot of resources, and our book will have a lot more resources and links to how to reach us. Please look into reading that book and reaching out to us. This contact information is all there in the book. Thank you.
Thank you so much. I love talking with you, and I will see you soon. Thank you, Dr. Geetha.
Appreciate it. Have a wonderful day. Stay healthy, stay fit. Take care.